decided to feature 12 people that had various mental health diagnoses and came from different backgrounds in life. And the idea behind it was to showcase what living with these illnesses is really like. Not just the kind of superficial perspective you get from reading People magazine or hearing someone say they have a diagnosis, but actually diving into what it's like to live with a diagnosis. And in each of the stories, I interview their family members, even those that they're not talking to. And I interview their coworkers and their psychiatrists, and I get their medical notes and charts from their psychiatrists. So it's a real act of courage on their part to share all of that. And they're sharing all of that to help others who, like them, are suffering from various types of mental illness and addictions, so that others don't have to feel as alone with their illness. Talking about these as something other than health issues, because they're really health issues. If it were cancer, they'd all ask, well, how's the treatment going, and how are they doing, and how are they feeling, and if it were any other illness. But with these illnesses, you kind of conflate the illness with the person. So people feel very uneasy talking about anyone with these illnesses or asking anybody about their illness, because it feels like it's encroaching on their personal space. Right. So what that leads to is the fact that we don't intervene until people are in a crisis. And, you know, with cancer, you would never begin treatment when it's stage 4 cancer. You know, you'd screen to try to capture it when it's stage 1. You know, that's what we do. And that's why treatment for cancer has gotten so much better. It's not just the therapeutics, it's the fact that we intervene early. And that's turned cancer from what was a death sentence to, for many cancers, a chronic illness, if they're, or you know, frankly, to be able to treat them and cure people. So, and unfortunately, as a nation, we've decided to, you know, commercialize marijuana, introduce sports betting. You know, that's on top of social media. Like it's as if we have our head in the sand. Like we think that somehow kids are suffering from anxiety more than ever. And what are we gonna do? We're gonna make marijuana ubiquitous. We're gonna make everyone think that it's harmless. And then we're gonna wonder why we have an addiction crisis, you know, that's even worse than today in 10 years. We know liquor stores are 13 times more likely to be in black neighborhoods than white neighborhoods. We know that marijuana pot shops, like liquor, you know, much greater likelihood they'll be in minority neighborhoods. Do we have pot dispensaries here in Brigantine? No. Are they all Atlantic City, Pleasantville? Yes. So, you know, what I'm working on is to try to get, and what President Biden is, increase the amount of money that's reimbursed for mental health and addiction services. If we want to plug the gap and access, we have to pay what we think this is worth. And right now we don't invest in this. And as I said, we wouldn't dream of not providing care for heart disease and diabetes and cancer, but we routinely do that every day. But I think that the mental health and addiction community in Atlantic City really needs to step up and let AtlantiCare know that they need access, and cutting back on access to detox and access to psychiatric interventions for suicide ideation is unacceptable.